I spoke with Mr. Bhavdeep Singh, Chief Executive Officer at Fortis Healthcare, and I began by asking about the top line growth and which segments saw strong growth.
I think certainly, as you've just mentioned, we're pleased with the quarter. It's turned out to be a good quarter all the way around. Just breaking up, if I look at some details beyond the headline, the good news is that we've seen growth in our hospital business and in our pathology business, in the SRL business as well, and that's certainly good. It's good to see when both arms of the business do well. I think on the pathology side, on the SRL side, our collection centers continue to do well. We were able to, because the country had challenges obviously with dengue, and while we're almost out of it, there's still a little bit out there. I think our team really did a fantastic job in serving the needs of Indians everywhere with respect to that. On the hospital side, I'm pleased to report that many of our hospitals did exceptionally well. Our FMRI hospital in Gurgaon had a record quarter and did really deliver some great numbers, and I think even more important than the numbers was what they delivered from a patient care perspective. We continue to get tremendous feedback on our clinicians and our nurses, and we're very pleased there. Beyond that, if you look across NCR, many of our other hospitals, Vasant Kunj, Shalimar Bagh did well, our Bombay hospitals did well, Bangalore did exceptionally well, the Chennai hospital in Muller, Fortis Muller did exceptionally well also. So the nice news is that this isn't about one or two or three or four segments of the business or specific hospitals or locations. We've had good, well-rounded performance, and I think primarily driven by the fact that we are absolutely maniacally focused on the patient, doing the right thing for the patient, and we're supported by some of the best doctors and nurses in India, and we feel very fortunate that they're working with us.
What was the average revenue per bed and the average length of stay? Because you've been trying to cut that down. Our
length of stay has stayed relatively stable. And our occupancy numbers are running in the high 70s. We're approaching 78, 79%. The RPOB numbers are about 1.4 CR. So I think that as we look at various metrics, we're satisfied with where we are. We continue to look at, our goal is to send patients home as quickly as possible, because who wants to be in a hospital, right? We want to take care of you and get you out of there as quickly as possible. So our goal is to do that, is to continue to take care of patients, ensure that whatever procedures they need, that we do them quickly, efficiently, and then get them back home so they can start living their lives again. So I would tell you that I think these numbers have done well. Occupancy numbers have gone up. But generally, I think we're in a fairly steady state area, and that's not a bad place to be. I think we're doing fairly well.
Your profit has come in at about 34 crore rupees versus a loss of 58 crore rupees, and I understand this has been because of the sale of international businesses as well. But there was an exceptional loss of 20 crore rupees because of a slump sale of the Kangra hospital. Why did you go for this slump sale?
We've made different investments along the way. The Kangra hospital was slightly about 60% of that number. We had an extraordinary loss in SRL as well. I think that any business, any organization, you assess the assets you have. You look at opportunities for growth. You look at opportunities where you have to contract. And we did what any good organization, any good business would do, is we assessed our assets, looked at some of the opportunities we had. And at this time, we thought it was just a good move for us to pull out of there. And we have some good partners there that we continue to work with and continue to provide some guidance and support to. But as an active engagement, we have pulled back on that.
So you still have a management contract for the Kangra hospital?
We have a limited management contract, yes. And I think that in the whole scheme of things, when you look at an enterprise that's as significant and large as ours, is to take care of as many patients as possible. I think that the O&M piece is a piece that's worked well for us. We'll continue to explore new opportunities around it. Like anything else in life, you try to do 8 or 9 different things. Every once in a while, 1 or 2 don't work, and you explore something else.
You managed to cut your finance costs as well as other expenses. Has this been the reason for the margin expansion you've seen in this quarter?
No, I would tell you that I think that the fact that we've reduced our debt has certainly helped with respect to carrying any financing cost. But I think that what's happening is that the business itself, so the mix of our business, the growth in our business, that's what's contributing to our growth. because ultimately, our debt load today is 1,000 crore, which for our size business obviously is perfectly fine. It's not something that I lose sleep over. But I think it's in the mix in our business. We are growing substantially. When you look at the transplant environment, for example, our hospital in Chennai, our Fortis Muller Hospital, has done 59 heart transplants, which makes it the leading heart transplant player in all of Asia. Liver transplants we continue to do. Our Noida hospital has done exceptionally well. We're doing heart transplants now in Delhi NCR as well, between our Fortis Escorts Hospital and the Gurgaon Hospital. So the cancer, the oncology business continues to do well, and the disease burden that's driven by oncology continues to grow in our country as well. So I think that it's the mix in business. It's the ability to serve our patients on multiple platforms with the different types of treatment we have. And quite honestly, that's what we'll see more and more of as we go forward. There are 500,000 people that die in India every year because they don't get an organ transplant that they need. So that's an example of more and more opportunities that organizations like ours are able to identify, where you can continue to serve the patients in India.
But how did the diagnostics business register 53% sequential growth in margins?
Their business, again, it's a very healthy growth. We look at underperforming centers from time to time, collection centers, and you assess those, just as I mentioned earlier, as any organization would do. You had the dengue season, which certainly impacts our top line and bottom line. And I think that good efficiencies, any business as you continue to mature, you're aware, just as I am, of organizations who've been around for many, many years. You continue to look at efficiencies, build efficiencies, become better at what you do. By virtue of that, certainly, if you do that and you continue to increase volumes, which we're doing, I think that certainly comes down to the bottom line.
What were the new beds added in the second quarter, and what has been the response to Fortis La Femme in Bengaluru?
We added in this quarter, about 250, 275 beds. As part of our India strategy, we have a huge opportunity. Today we're operating about 4,100 beds. Without adding one new hospital, we can probably go to 8,000 or 9,000 beds just in brownfield by building towers or new medical specialties, or capitalizing on the space we have. With respect to our new La Femme hospital in Bangalore, this is a fantastic hospital. It's the second La Femme hospital that we've opened, our first one being in Greater Kailash. We're very excited about it. We had our first birth in that hospital about 2.5 weeks back. This is just a fantastic hospital, a women and children hospital, and this is just the start. The La Femme brand is going to be a fantastic brand. It's going to continue to do. We'll continue to open more and more hospitals. Lots more. I'd love to discuss more and more of that as time goes on, because I think that's a great story coming up.
Now, you've increased your stake in SRL to 57%, giving an exit route to Saver Partners. What exit options are you giving to other investors, and where does this leave you in your IPO journey?
So there's no IPO journey to speak of. I think that's the first thing I should tell you. The financial structure we have today, we're very happy with. So there's nothing really to discuss there. I think that where there are investors that look to get out, we're not actively looking to increase our share. However, on the basis of first of right refusal, if there's investors that are looking to explore other options, listen, we think this is a fantastic business. The results indicate that. We continue to do extremely well. More and more tests, more and more diagnostics. We've invested quite a bit. So we're very, very happy with the business. Again, based on first of right refusal, would we consider doing something? Maybe. Is that going to lead to an IPO? Not in the cards. We're very happy with the financial structure we have today.